Hello, my name is Florian Lagler and I'm a pediatrician and pharmacologist by training. I see patients with lysosomal storage diseases here in Salzburg at the Paracelsus Medical University, Salzburg. This includes a lot of MPS patients, patients with mucopolysaccharidosis. The mucopolysaccharidoses refer to the group of lysosomal storage diseases. All of these diseases are very rare and they are based on an enzymatic defect. This means an enzyme in the body of the patient is not fully active, and that leads to accumulation of metabolites. The accumulation of metabolites leads to swelling and dysfunction of the cells, of the organs, and then to a plenty of clinical symptoms. What are the first symptoms in the life of an MPS patient? This can vary from patient to patient and from MPS form to MPS form. Early signs can be hernia, inguinal hernia, umbilical hernia, for example, or also hydrocephalus, for example. ENT problems like enlargement of tonsils and adenoids are also early signs. This comes with the fact that many of the MPS patients need surgical procedures rather early in their life. The Hunter syndrome is a chronically progressive disease, so it can start very early and symptoms are increasing in severity. This can come with a diagnostic odyssey for the families. The parents may recognize at some point that their child may be different from the siblings or may be different from other children. They approach a physician, maybe the pediatrician, and sometimes it takes some time, quite a while, until the proper diagnostics are done. The difficulty in doing the early diagnosis is in recognizing the patterns, because the single symptoms are rather unspecific. Well, the diagnostic odyssey, or in other words, the time until the patients are referred to further workup in a specialized center, can vary substantially. On the one hand, because of the different courses of disease, there is mild courses that more or less present only in adulthood or in adolescence. Obviously, these patients reach the specialized center rather late after the first symptoms. On the other hand, it can be challenging for pediatricians and other physicians to recognize the patterns that indicate a rare disease like mucopolysaccharidosis. So sometimes it takes the parents 5 or 6 years until they are referred to a specialist who can do the diagnosis. So many patients and their families are really disappointed by the health system because they face situations in which they again and again have to repeat the problems of a Hunter's patient, the problems of their children. Hunter's disease is a chronically progressive disease. That means that even in treated patients can develop complications of the disease. As it is a very rare disease, a general pediatrician may not be aware of that. This is why a Hunter's patient needs follow-up at a specialized center. There is not many diseases in pediatrics that change the life of the families so substantially than mucopolysaccharidosis. It's a very complex disease. These patients need a lot of surgical procedure. They always need an interdisciplinary team that takes care for them. And that comes with a lot of demand to their parents, to their family. And it's really good to know if there is a patient organization that kind of supports these families and helps mastering the situation. It's really an enormous challenge for these families. One benefit of being followed up in a specialized center is that we do regular checkups for the families, and that gives a lot of security to them. On the one hand, they have to spend some days in the hospital to get the diagnostics done. On the other hand, they get a lot of information, care and safety when the regular checkups are done. And I have the impression that after a diagnostic odyssey, it's always a big relief for the families to finally end up at a specialized center.